if you break an arm, an X-ray gives you this really clean binary answer. It's broken or it's not. The doctor points to a jagged white line on a screen, and there's a certain comfort in that precision.
Yeah, absolutely.
But when you step into the world of sports biomechanics, specifically those devastating non-contact knee injuries.
Oh, the word.
Right, where an athlete tears an ACL without ever being touched by another player.
Yeah.
The diagnostic landscape is just incredibly murky.
It really is.
Because the damage isn't just about a single obvious moment of impact. It's a complex web of kinetic energy and joint angles and microscopic timing. So today we're doing a deep dive into a paper that finally clears up some of that muddy water. We are looking at a 2026 article from the Journal of Sports Science and Medicine, and it's titled Inter-Segmental Timing as a Contributing Factor to Knee Loading in Stop Jump Landings.
And it's a phenomenal piece of research. It's authored by a powerhouse team, Cedric Schwartz, Julien Paulus, Jean-Louis Croisier, Laura Delhauteur, Etienne Dubois, and Jean-François Kaux.
Right.
And they're out of the University of Liège in Belgium. And what makes their approach so valuable is that they isolated a very specific, highly demanding, game-realistic movement called the stop jump.
Okay.
They really wanted to figure out exactly what is putting the knee at such severe risk.
And the mission of this deep dive is to explore those exact biomechanics. Because, in sports like basketball and volleyball, jumping and landing aren't just occasional actions.
No, they're constant.
Right. They're the absolute DNA of the game, and they carry a massive chronic risk for traumatic injuries like ACL tears, as well as overuse injuries like patellar tendinopathy.
Which we commonly call jumper's knee.
Jumper's knee, right. And that's a condition affecting over 20% of adult players.
That's hugely prevalent.
Yeah.
So to understand the findings, we first need to visualize the stop jump so we know exactly what mechanical event we're analyzing here.
Okay.
This is not a standard standing vertical leap where you just bend your knees and go straight up.
Right.
The athlete takes a rapid horizontal run-up, usually about 3 quick explosive steps.
It's like a fast break.
Exactly. Then they perform a horizontal landing to arrest that forward momentum and instantly transition into a powerful vertical push-off, followed by a final vertical landing.
So you essentially have two completely distinct landings happening just fractions of a second apart.
Yes.
The first landing is hitting the brakes on a forward sprint, and the second landing is coming down from a maximum vertical leap.
And comparing the biomechanics of those two specific phases is the core of this paper.
Yeah.
The researchers brought 33 male basketball and volleyball players into their motion capture lab.
Okay.
These are all active guys playing at least 3 times a week, meaning their nervous systems are highly accustomed to performing this exact sequence.
Right, so they're not beginners. They know how to do this.
Exactly.
So the team attached 20 different 3D markers across the players' lower limbs and pelvis, and they had them perform these full-speed stop jumps onto high-frequency force plates that were embedded in the floor. And the contrast between how the human body handles a vertical landing versus the horizontal landing is striking.
It really is.
Let's look at the vertical landing first, coming down from the peak of the jump. The data paints a picture of relative harmony.
It's a classic, well-distributed shock absorption strategy.
Okay.
The force plates in the 3D markers showed that during the vertical landing, players naturally default to a forefoot strike.
Interesting.
The data notes an ankle dorsiflexion of minus 15.3 degrees.
Okay, so to translate that into plain English, the foot is pointed slightly downward.
Right.
About 15 degrees, meaning the ball of the foot takes the impact first.
Exactly. And that specific angle of the foot changes everything about how the leg handles the weight.
Because landing on the ball of your foot engages the triceps surae, right? The calf muscles.
Yes, it turns the ankle and the calf into a massive elastic shock absorber.
Oh, wow.
When the forefoot hits, the heel is still floating off the ground.
Right.
As the heel slowly drops downward under the athlete's weight, the calf muscle elongates under tension. And that controlled stretching dissipates a huge amount of the kinetic energy before it can travel further up the leg. The ankle, the knee, and the hip are all working together in sequence to cushion the blow.
But then we look at the horizontal landing, the violent braking phase at the end of the sprint.
Right.
The paper calls this a stiffer strategy, which frankly feels like an understatement when you look at the raw numbers.
It really is an understatement.
Yeah, compared to that smooth vertical landing we just described, the player's hip flexion was reduced by 75%.
Wow.
Knee flexion was down by 22%. And ankle movement, that shock-absorbing downward point of the foot, was reduced by 56%.
They are practically landing with rigid legs.
Right.
And the root cause of this stiffness is the initial point of contact. During that horizontal braking phase, athletes have a very strong tendency to land on their heels.
Okay.
It's a rear foot strike.
And if you hit the floor with your heel first, that incredible calf muscle shock absorber is completely bypassed?
It's totally out of the equation.
Why?
Because the foot is pointed upward rather than downward, the calf muscles have no room to stretch and absorb force.
Right.
But the kinetic energy generated by the forward sprint doesn't just disappear.
No, energy has to go somewhere.
Exactly. Since the ankle joint and the calf muscles aren't taking their share of the load, the quadriceps and the knee joint are forced to step up. They have to manage almost the entirety of that massive deceleration force on their own.
Which leads us directly into the terrifying numbers regarding the internal forces on the knee joint itself.
Yeah, this part is rough.
Because the calf is offline, the knee takes an absolute beating. The paper measured anterior tibial shear force. And for anyone not familiar with the anatomy, this is the mechanical force pushing your shin bone, the tibia, forward relative to your thigh bone, the femur.
Right. It is the precise physical load that tests the structural limits of the anterior cruciate ligament, the ACL.
The ACL, right.
The ACL's primary anatomical job is to strap the shin bone in place and stop it from sliding too far forward.
And during this stiff horizontal landing, that shear force pushing the shin bone forward is 121% higher than in the vertical landing.
Which is just wild.
You are more than doubling the stress trying to rip that ligament apart.
And the patellar tendon doesn't fare any better. The stress that causes jumper's knee, the patellar tendon force, is 156% higher during the horizontal landing.
Oh my gosh.
We are talking about a peak force hitting that tendon equivalent to 5.15 times the athlete's body weight.
Wow.
Compare that to about 3.55 times their body weight in the vertical landing.
Okay.
Imagine weighing 200 pounds and suddenly over 1,000 pounds of force is localized squarely on the tendon below your kneecap.
That is just brutal. And alongside those sheer forward forces, the researchers also looked at the structural alignment of the knee during the impact.
Yeah.
They tracked dynamic knee valgus using a metric called the knee-to-ankle separation ratio, or KAR.
Right.
And basically, they were measuring whether the knees were caving inward toward each other in like an X shape when the feet hit the ground.
And they found that during the entirety of the horizontal landing phase, the athletes exhibited sustained dynamic knee valgus.
Okay.
The knees cave inward upon impact.
Yeah.
And critically, they stay caved inward while they are decelerating.
While the force is highest.
Yeah, exactly.
Yeah.
This puts immense asymmetrical strain on the medial and lateral structures of the joint. By contrast, in the vertical landing, if an athlete's knees cave in slightly upon initial impact, they tend to quickly correct and resolve that alignment as they sink into a squat to absorb the force.
Wait, I have to stop and ask a genuine question here.
Sure.
Because if landing on our heels with stiff, straight legs is this catastrophic for our knees, why do our bodies default to doing it?
Yeah, it's a great question.
Are our bodies just poorly designed for sports like basketball, or is there a biomechanical reason we instinctively brace like this instead of landing softly on our toes?
It's not necessarily a biological design flaw. It's a response to geometry and physics.
Okay.
Think about where your center of mass is when you are sprinting forward. If you suddenly need to hit the brakes and jump backward or straight up, you have to place your feet on the ground well in front of your body's center of mass.
Sure.
Your landing point is necessarily anterior to your torso.
Because if I put my feet directly underneath my center of mass while sprinting, I wouldn't stop.
No, you wouldn't.
I'd just trip over my own momentum and eat the floor.
Exactly. To get your feet far enough out in front of you to act as brakes, you naturally have to flex your hips, extend your legs outward, and strike with the heel to create maximum friction against the floor.
I see.
The inherent biomechanical geometry of a horizontal landing isn't the problem in isolation. The danger arises when athletes combine that necessary posture with what the paper calls non-modifiable factors.
Like their total body mass and how fast they are running.
Right. And then they fail to utilize the modifiable factors to protect themselves.
Modifiable meaning things they can actually control in midair, like how much they bend their knees upon impact. Yeah.
Knee amplitude. The paper explicitly shows that if you don't actively increase your knee flexion during that horizontal phase to dissipate the energy, You send a shock wave straight through the patellar tendon and the ACL.
Wow.
You can't change the fact that your feet need to be out in front of you, but you can change how rigid your legs are when they hit the floor.
Okay, so we've established that stiff horizontal heel strikes are a recipe for knee destruction.
Absolutely.
But the researchers didn't stop at joint angles and stiffness. They looked at time.
Yeah.
Specifically, they looked at the microscopic fractions of a second between the left foot hitting the ground and the right foot hitting the ground.
Right.
They call this inter-segmental timing.
And this is arguably the most novel breakthrough finding in the entire study.
Really?
For decades, biomechanical research tended to look at pristine, isolated extremes. You had studies on purely one-leg landings, like a single-leg hop test in a clinical setting. Or you had studies on purely simultaneous two-leg landings, like an athlete dropping off a perfectly level box in a highly controlled laboratory environment.
But sports aren't played in a sterile vacuum.
Exactly.
I mean, a stop jump in a real game on a fast break is rarely perfectly symmetrical. You are moving, reacting, dodging.
The researchers recognized that the stop jump is an intermediate, often asymmetrical situation.
Okay.
To analyze this messy real-world data, they use something called linear mixed models.
Sounds complicated.
It is, but without getting bogged down in the deep statistics, this is a very robust analytical approach that accounts for natural, subject-specific variability, much better than just running simple averages.
Right.
It allowed them to isolate specific variables to see what was truly driving the knee stress.
Yeah.
And they proved that even a fractional delay between the 2 feet hitting the ground is a massive, independent predictor of knee joint loading.
Wow. I was trying to visualize the physics of this timing delay, and the best analogy I could come up with is like dropping a heavy wooden dining table onto a concrete floor.
Oh, that's a good one.
Right. If you drop that table and it lands perfectly flat.
Like completely synchronized on all 4 legs at the exact same millisecond.
Exactly. The floor and the structure of the table distribute the shock evenly across the whole system.
Sure.
The impact is loud, but the table survives.
Right, it handles it.
However, if you drop it slightly tilted so just one leg hits the concrete a fraction of a second before the other smack down.
Yeah.
Right, that first point of contact absorbs a catastrophic amount of force. The single leg splinters instantly.
That is a brilliant mechanical representation of what is happening to the human body.
Mm.
In that fraction of a second, when one foot hits early during a high-speed stop jump, that single leg is acting like the tilted table leg.
Wow.
It is forced to decelerate the body's entire mass and kinetic energy alone before the trailing leg can touch down and help share the load.
That's terrifying.
The linear mixed model showed that this landing delay, this lack of synchronization, significantly spiked both the maximal patellar tendon force and the maximal anterior tibial shear force.
And the study found it predicted this across the board in both the horizontal and the vertical landing phases.
Yes.
This means intersegmental timing isn't just a minor quirk of an individual's jump technique. It is a major contributing factor to injury, right up there with how fast they are sprinting or how much they weigh.
It completely reframes how we should be looking at landing mechanics. We have spent so much time analyzing the angles of the joints in freeze frame that we almost miss the critical nature of the timing of the impact.
Okay, so we need to take this out of the high-tech motion capture lab and put it on the basketball court or the volleyball sand.
Right.
If a physical therapist, a coach, or an athlete is listening to this, how do they actually apply these findings?
Yeah, that's the real question.
We talked about modifiable versus non-modifiable factors. We know a player's weight is essentially static during a game. And kinetic velocity, how fast you're running, is crucial because forward speed dictates those dangerous horizontal forces, and downward speed dictates the vertical forces.
Right.
But a coach can't realistically tell an athlete, hey, I need you to run slower on the fast break so you don't hurt your knee.
No, definitely not. Athletic performance always has to be maintained. So training programs must focus entirely on the modifiable factors.
Okay.
The obvious first step, which we covered, is training athletes to actively increase their knee range of motion, getting them to deliberately flex their knees more deeply during the horizontal braking phase to absorb the shock.
Bend the knees, got it.
But the second and much newer tool is training feet synchronization. We need to train athletes to minimize that intersegmental delay at impact so they aren't dropping the heavy table on one leg.
Now, since we know that landing on the heels during the horizontal phase bypasses the calf muscles and destroys the knee, I have to ask, why not just teach athletes to completely alter their fundamental mechanics? Like, why not train them to force a forefoot landing even when they're hitting the brakes? Wouldn't that let the ankle absorb the shock and save the knee entirely?
Theoretically, yes. But the researchers are very careful to point out a major caveat here.
Okay.
Earlier sports science research has shown that if you force an athlete to use a forefoot landing during a horizontal braking task, it significantly decreases their subsequent jump height.
Oh, wow.
Yeah,
So you might save the knee from taking a beating, but you completely neuter their ability to go up for a rebound or block a spike.
exactly. And any injury prevention program has to live in the real world of competitive sports.
Right.
You have to balance structural safety with athletic performance. If a landing technique reduces an elite volleyball player's vertical leap by several inches, they simply aren't going to use it in a game.
They just won't do it.
Right. The biomechanics have to serve the sport, not the other way around.
That is a vital reality check. And speaking of reality checks, I want to make sure we transparently cover the limitations of the study because the authors were very upfront about what their data can and cannot tell us.
Always important.
First, they used a 2D estimation for the patellar tendon forces. The human knee is a deeply complex 3D structure. And the researchers note they use numerical approximations based on sagittal knee moments.
So to translate that, a sagittal knee moment basically refers to the forces acting on the knee in a straightforward and backward plane.
Okay.
They calculate this using a process called inverse dynamics.
Inverse dynamics.
Yeah. Instead of putting a physical sensor inside the knee, which would obviously require highly invasive surgery.
Yeah, no athlete is signing up for that.
No, definitely not. So they take the force measured by the plate on the floor and work their way up the kinetic chain mathematically.
Oh, I see.
They solve the physics puzzle backward from the floor through the ankle up to the knee to estimate the stress on the joint.
Wow, that's clever.
It is, but the limitation is that this doesn't fully account for muscle co-contraction.
Meaning it doesn't measure how the hamstrings on the back of the leg and the quadriceps on the front of the leg might be firing at the exact same time to brace and stabilize the joint from different angles.
Exactly. It's a highly educated mathematical estimate of the joint load, not a direct in vivo measurement of every single muscle fiber's tension.
Okay, that makes sense. The other major limitation to highlight is the sample population. The study exclusively tested 33 male players.
Right.
We know from a large body of previous sports science literature that there are distinct kinematic differences between male and female athletes during jump and landing tasks.
Huge differences, yeah.
This is especially true regarding dynamic knee valgus, that inward caving of the knees, and overall ACL injury rates, which are significantly higher in female athletes.
Yeah, the mechanisms and rates of injury differ vastly across demographics, largely due to anatomical differences like pelvic width, as well as distinct neuromuscular control strategies. So while these findings on intersegmental timing are groundbreaking, we cannot blindly generalize them to female athletes without further specific dedicated research.
Right. We need to see this exact study run again with a female cohort.
Exactly.
Okay, well, let's bring all these threads together. The ultimate takeaway from this deep dive is twofold. First, the horizontal landing phase of a stop jump is structurally much riskier than the vertical phase.
Yes.
It naturally forces a stiff rear foot landing strategy that bypasses the shock-absorbing calf muscles. And that dumps massive amounts of shear force and tendon stress directly into the knee joint, often while the joint is actively caving inward.
And second, beyond simply telling athletes to bend their knees more, the microscopic timing of the feet hitting the floor is a previously underappreciated piece of the puzzle.
Right, the intersegmental timing.
That intersegmental delay acts as a dangerous force multiplier on whichever leg hits first.
Dropping the table on one leg?
Exactly.
Teaching better synchronization and body control in the air could quite literally save careers.
It really could.
The amount of data and insight that Cedric, Schwartz, and the team at the University of Liège packed into this paper is just incredible. If you want to dive deeper into the science and see exactly how they proved this, I highly encourage you to go read the full article in the Journal of Sports Science and Medicine published in 2026.
Yeah, you really have to see the charts.
Right. Seeing their biomechanical models, the graphs, and the statistical parametric mapping visually really drives the point home in a way audio just can't. And of course, if you want to keep exploring the rigorous research that shapes the sports and medical world, make sure to follow this channel and turn on notifications so you don't miss our future deep dives.
As we wrap up, I want to leave you with one final thought based on a brief but fascinating mention in the paper regarding external perturbations.
Okay.
The authors note that these dangerous asymmetrical out-of-sync landings rarely happen in a quiet gym during a solo practice drill.
Right, you're not getting injured alone usually.
Right? You land out of sync because the game is chaotic. An opponent throws a fake pass or executes a crossover dribble midair, and your brain forces your body to react, twist, and reach at the very last millisecond.
Wow, yeah.
The worst physical loading on the joint is almost always the result of cognitive deception by an opponent.
That is so interesting.
So ponder this. If we know that the root cause of the biomechanical failure is often a split-second cognitive reaction, how must the future of sports training evolve? Can we move beyond doing isolated box jumps in a pristine environment? We might be looking at the rise of virtual reality or safe reactive chaos training environments where athletes are repeatedly exposed to deceiving visual stimuli while in midair.
Oh, wow.
The ultimate frontier of injury prevention might not just be strengthening the knee. It might be training the neuromuscular system to instinctively correct that intersegmental timing before the foot ever hits the floor, no matter how completely an opponent fakes them out.